and welcome, Dr. Joy Jones. So happy to have you here on our EWA interview, and you are a very special part of our network, Joy.
Thank
you. You have an amazing background. So would you share with our audience a little bit about where you come from, who you are, and how you got to where you are today?
All right. Well, it's so nice to be here with everybody. I would definitely like to share a little bit about my story. I am a California girl through and through, born in Los Angeles, raised really for the most part in Los Angeles. My family is from the Caribbean and America, so I have strong Trinidadian roots. But for all intents and purposes, I consider myself an LA girl. Really grew up in a two-parent home. I was an only child, but I had tons of extended family members, so I felt like I did have a bigger family than one would assume for an only child. And really from, I would say probably from 5 years old, education was the cornerstone of, I guess, my purpose in existence. Coming from a Caribbean family, education was really pushed. Like everybody, all of my aunts and uncles were pushed to be doctors, regardless of what kind of industry or field they wanted to go into. Some became medical doctors, others became PhDs in education and various things. But the whole idea was that education really would be the thing that would open doors. That even, other things may not be able to open. So I was raised to kind of learn to excel in school. That was considered to be my job. That's what my parents told me. Your job is to do well in school. We're taking care of the bills, the rent, all of that, but your job is to do well in school. So I really went to I guess, private schools. My parents did not have a whole lot of money, but that was one of the things that they sacrificed to make sure that I had a really good education. And really the whole family rallied around that. So my aunt would drive me an hour and a half to a private high school in Pasadena because it was a college preparatory school. So I went to Polytechnic in Pasadena. And then they rallied again to make sure that I got into Duke. And I think for a person that looked like me in Los Angeles at that time, like my path was very unorthodox. Like none of my peers were going to private schools or getting into these really good schools. And I really do credit my parents for being able to think outside of the box and being able to find ways to expose me to opportunities that I probably would have never had a chance to experience. For example, like my mother would find free summer programs, or if the museum was doing something free for the community, she'd take me there, And I really do appreciate that because even as a young child, it broadened my horizons. It made me think that nothing's impossible. So I did go to Duke. I went there with plans to become a doctor and a lawyer. At the time, they had a 7-year MD, JD program, and it was supposed to fast track you into medicine and law. And I started to look into that program. I thought, oh no, I'm going to have like no social life. Like I won't be able to do anything. Like, yeah, maybe at the end of the day, I'll have all of these degrees, but I would have missed my whole college experience, So I decided to become pre-med. And because I've always had all of these interests in arts and the social sciences, I did a dual major in what was called comparative area studies. It was Duke's way of saying you can create your own major and just do all of the things that you're really interested in. So I took language courses and, anthropology courses, and it really ended up being like an anthropological degree. When I finished Duke, all of my peers were going off to medical school, and I just did not feel that that was right for me. I didn't even take my MCAT or anything. I just felt like I'm not sure if medicine is my calling. There was a lot of pressure from family that, that this is what I should do. And I really wanted to be sure that this was what I was called to do. What I did know is that I had a lot of interest in medicine, a lot of interest in people and cultures. And I came across this program at the University of London, the School of Oriental and African Studies, and it was to study medical anthropology. And I said, oh, that's perfect. That's exactly what I should do. I don't really understand what it is, but it sounds fascinating. It turned out to be the study of the way people interpret illness and health, how they heal, how that, interplays on a socio-political platform. I mean, it just really was fascinating. And so I moved to London. I didn't know anybody at the time, just fresh out of college. I don't know how my parents let me do it, but they did. And it was just an incredible time, not just for everything I learned in the program, but I felt like it was a place where I really came into my own. I started to come into my own as a woman, as an artist. I was really involved in the art scene while I was there. And it really started to kind of put me on the path towards what I believe will eventually be a global career. So after I finished that program, I came back. I really wanted to go on to study business at a program in Paris. Part of me just didn't want to come home. and so I was just trying to find different programs that I could start joining. And my parents kind of got wind of that, and they were like, no, you need to come home. So I came home reluctantly. I'm very grateful that I did, because unbeknownst to me, probably about a year and a half later, my father would die suddenly of a heart attack. And when I look back, I'm so grateful that I was able to spend that time with him. He wasn't ill or anything during that time. So it was a very sudden event, and we didn't see it coming. But I'm so grateful that I came back and had that time to spend with him. As you can imagine, I was a daddy's girl, still am a daddy's girl. So literally my world fell apart. Like the earth beneath me just kind of crumbled. And we had a family business, which ran group homes for people who had physical and mental disabilities or were physically and mentally challenged. And so now my mother was stuck to try to run this business on her own. So, and I'm an only child, so there's really no siblings or anything to step in. So I was able to kind of step into that position to help my mother and to get the business in a good place so that we could sell it and she could retire. So I was once again grateful that I was there, that I could do that. When that finished, I was wondering, like, what should I do now? What do I do? I was still thinking about medicine. I was not sure that was what I wanted to do, but I knew I wanted to do something kind of in the nonprofit realm. Anthropology was great, but for me, it felt more like I was going into cultures and societies, and I was just studying them and observing them and writing about them, but I wasn't really changing things for them, or helping them in a tangible way. So when I decided to go to public health school, that allowed me to learn how to formulate programs and devise campaigns on a global level to help communities in need. And I thought, okay, this is great. I started to go on a lot of international health missions. We went to Ghana and worked in refugee camps. I went to India, South Africa. And so really that was what I was doing for a few years. And once again, that was great, but I felt like I wanted to do more. And as you can see, like throughout my journey, it's always been a question of, is there more that I can do? And perhaps I'm doing something perhaps I'm being called to something that does not exist. I don't know if you can see that, but that's definitely how my journey has gone. It's really the road less traveled.
Well, that's why we chose you to be part of our organization, because you are an exceptional woman who walks the road less traveled. So, Joy, you went to medical school. At that point, you went to medical school, right? Or you had already been to medical school? Or was that
Yeah,
the
at that point, I went to medical school at Loma Linda. I came in there really wanting to be a psychiatrist, and then got very interested in primary care because I saw such a need. And then thought, well, maybe there's a way I can do both. Eventually, I ended up graduating and going into family medicine residency. But even after residency, I said, I still want to do mental health. The people I was seeing in the community were coming in for, maybe a broken arm or, problem sleeping. But when we would get to the root of what was going on, there was often domestic violence and depression or undiagnosed schizophrenia. And there really weren't people on the front lines to address this, because these weren't people that were actually going to go in to see a psychiatrist or were going to be seen by a therapist. It was going to be on the primary care doctor to do that. So I felt like, especially in communities that are underserved and communities of color, I would be perfectly poised to do something like that.
That's amazing. And really, in fact, there's probably even a social stigma associated with the whole idea of getting care for mental issues within certain communities. And I guess that you were very well poised to identify that and to deal with it.
Absolutely. I think that is the biggest thing, is that I'm able to really start a conversation and talk to people about these issues. Whereas, they're like, we don't usually talk about that, or nobody in my family has even looked at getting therapy, but we all have these issues. And I can look back at how my mother and my grandmother dealt with depression, so there really is an opportunity to stop these kind of generational ailments and curses. And so I'm currently at UCLA in the VA, completing my psychiatry residency. I went back to residency to do this in hopes that I will be able to really be an advocate for people that, have not had access to this in the past.
Joy, when I look at your background, and I know when I first met you, you just stunned me with the vastness and diversity of your experiences, which are huge. So you also have an MBA, right? You didn't mention that. So kind of throw a little bit in about that. Why, on top of doing a family residency, which is tough enough as it is because of all the on-night calls and weekend calls, you also decided to sign up and do an MBA. Tell me what motivated that.
Well, I have a difficult time talking about myself, but I really was drawn to the MBA because ultimately I know that I don't want to work for anybody. I know that I want to work for myself. I mean, I may like to be a consultant for other people in the future, but ultimately I would like to create my own entity and run that. And so I felt like an MBA was going to be very important. I know lots of doctors who are not very good at taking care of their money. They can make the money, but, they get tied up in really bad investment decisions, and they really don't know how to make their money grow. I don't tend to be a very materialistic person at all, but I am very interested in what money can do for other people, and really being able to find ways to grow wealth, not just be rich, but I really want to grow wealth. So that's really why I decided to go and get the MBA. And then also, financial health is part of my idea of helping people become holistic and holistically well, like mind, body, spirit, but also your finances. Because, when we see communities that don't have access to, proper financial resources, they suffer across the spectrum.
Absolutely. And again, that's one of the reasons the holistic approach is the way we look at EWA. And you've been a mentor liaison also for our EWA program, which was fabulous. And tell me a little bit about that experience of mentoring one of our outstanding leaders, you yourself being an outstanding leader. Was that reciprocal? Was there sort of co-mentoring going on with that?
Definitely co-mentoring. And I think in terms of the organization, LSS in general, I mean, you give, but you get so much in return. There's just such a wealth of knowledge and experience. And these incredible women are allowed to be in a space where they can take their armor off, because we all know as women in our various areas of expertise, we do have to put on, I guess, the armor of strength, and, that say that I'm capable, and, to be able to be in a space where we can just be women, and talk about our struggles and, the things that we really need to work on. It's just been incredible. And just really the true gift. The woman that I was able to mentor, just in her own right, is an extraordinary woman. And I almost felt a little like, what am I going to offer to her? Because she's so great. But it really showed me that, yes, Joy, you do have something to give, and you can get so much from her as well. And so that really has been the theme in my journey with LSS, and I'm grateful for it. And it was business school that brought me to you guys. So
I know. It's a wonderful thing. It's a wonderful thing. So Joy, you're now in the front lines of the COVID virus, and you're doing on call at the Veterans Administration, and you're in psychiatry and doing a residency. Tell us what's going on and what is your experience on the front lines?
Well, I must say it's been a very sobering experience overall. I don't know that anybody can be completely prepared for something like this. Even all of my training in disaster preparedness, and I mean, even when I was in Africa a couple years ago, we did Ebola training. I mean, I was able to be exposed to, I guess, the theoretical possibilities of this, to be in a situation where you're seeing these things firsthand, and to really feel the anxiety that comes along with it. It's overwhelming at times. I'm very concerned about the healthcare workers that are on the front line, because you can only give so much for so long. And I think we're starting to see across the nation people who are, kind of breaking down. I mean, and I believe that for years to come, a lot of us will have a post-traumatic reaction to all of this. And it can be post-traumatic stress, but it can also be post-traumatic growth. It doesn't have to be, that things will just be terrible going forward. I think that moments like this do bring people together and do make people stronger. But I think for myself, it has been very difficult to see so many people sick with something that is so unknown. We're still trying to figure out the parameters of this virus, and we don't have very good established treatments for the virus. We're just kind of all, doing the best that we can. And you don't know who has it and who doesn't have it. And so, you could be exposed and could be carrying it, and you have no idea. You could be asymptomatic. So I'm seeing just a lot of patients who are anxious. Being in the hospital is a stressful experience in and of its own. But, when you have that on top of it, it just adds to another level of difficulty. So I think overall it has been a very trying experience, but I am doing my best to maintain self-care. Of course, self-care looks very different when you can't go to the gym and you can't get massages and you can't hug and kiss on people. So I've had to be very creative, but I really do believe that is part of what's going to help people stay sane during this time.
Well, Joy, there's no doubt that you are a source of enormous inspiration to not only the women in our group, but to people who are watching this program, and also to your patients and co-workers. And I am so grateful that you came into my life, and we could spend probably 3 hours talking. And so I'm going to have you back when we do another show.
Absolutely.
And just want to thank you for being you and for being part of our EWA network.
Thank you. It's been my pleasure. I love you all.
Okay, thanks, Joy. Bye-bye.